Hi, everyone. Our project is called Improving Patient Inter-Questionnaires Experience for Duke Health Patients. An introduction to our project. Electronic patient questionnaires play a very important role in the Duke Health system by saving both time and effort for clinics and staff and in improving patient satisfaction. However, response rates for Duke patient questionnaires usually are around a 30% completion rate or lower, which defeats the purpose of having these electronic patient questionnaires in the first place. To address these issues, we'll be looking at a few factors that could influence the response rates of patient-entered questionnaires. So we have two main objectives. Number one, we want to look at which questionnaires have the highest and lowest submission completion rates. Under the first objective, we'll also be looking at their association with questionnaire length and number of questionnaires assigned per encounter. For the second objective, we'll be seeing what the association is between factors like gender, race, ethnicity, primary language, and the likelihood of the questionnaire being submitted or completed. We also have a few hypotheses corresponding to our project objectives as shown in the poster.
So about our data set included patient-reported outcomes and also custom intake forms that were assigned to these patients, and our time frame was between January and December of 2023. Our data set had questionnaire information as well as patient information that included number of questionnaires assigned to those patients, submission level, and other demographics. And further, our data set was divided into training and testing groups with the patients randomly allocated 1-to-1.
So our methods for addressing these objectives were first to use linear regressions to test for a linear relationship between number of questions in a questionnaire or time spent on a questionnaire and that questionnaires individual submission and completion. And second was to use a binomial GE to find adjusted odds of submitting a questionnaire given different demographic variables and the number of questionnaires assigned per encounter. So we started with some exploratory analysis. Here we just have a pie chart of the distribution of race in our data set. And we also found our overall submission rate around 37%, with the average percentage of a questionnaire completed a little bit lower at 35%. With these plots, we see the relationship between questions in the questionnaire and submission rate, not much of a visible linear relationship. And we also have a forest plot with odds ratios, lower odds to the left and higher odds to the right, with each different demographic category being compared to a reference group. So our conclusions, we found that there wasn't enough evidence to conclude that there was a significant linear relationship between submission/completion and questionnaire length. And we saw that for the total number of questionnaires assigned to an encounter, as that increases, the odds of a patient submitting a questionnaire also increases, which was an unexpected finding. And we also found some other things, some agreeing with our hypotheses and some not. We saw that compared to their respective reference groups, male patients, non-white patients, non-Medicare patients, and non-married/partnered patients had lower odds of submitting a questionnaire, holding other factors constant. We saw that Hispanic or Latino patients had higher odds of submitting a questionnaire compared to non-Hispanic or Latino patients. And we saw no significant difference in the odds of submission by age or compared to reference group for patients who had a primary language of Spanish or who had primary insurance of Medicare.
A limitation we had during this project were their questionnaires that were not submitted were considered 0% complete. However, some of those patients may have answered some of the questions in the questionnaire, so we weren't able to access that data. Also, our analysis didn't account for some social demographic factors like education level or the area deprivation index. In the future, we hope to explore the relationship between questionnaire submission and completion rates and some intrinsic deficiencies of specific questionnaires. One way to do it is to look at the relationship between submission rates and workflow duration. And we also aim to investigate an expected relationship between the odds of submission and the number of questionnaires assigned in that encounter. Thank you.